Hi all, let's cover a very important topic, preterm nutrition and monitoring. So what are our goals? American Academy of Pediatrics recommends growth of the baby parallel to the intrauterine growth. So our growth of our preterm baby should be absolutely parallel to how it must be growing in the womb. Alright, but what are the problems associated with preterm birth that leads to lack of adequate weight gain or problems with feeding? So, first of all, the preterms are born with limited nutrient stores because most of the nutrients are exchanged during the last trimester. And if the baby is born during the trimester, if the baby is born preterm, so they'll have limited nutrient stores. They have high metabolic needs because of the growing body, or because of the ongoing infection or any other chronic illness. So the next thing is the immature GI mortality. So they have a immature gastrointestinal tract. They have limited enzymes for digestion. The catabolic effect of illness is more pronounced in preterms. They have increased nutrient intake. They have increased nutrient requirement, which is needed for the rapid growth of these babies. Alright, so these are the problems that we face while giving nutrition to the babies. So the question is, what is the usual pattern of growth of a preterm baby in early postnatal days, and what should be the target growth parameter for such babies? So, the postnatal growth differs from intrauterine growth as it begins with initial period of weight loss. We know when there is initial diuresis in every baby because of their immature kidney. There is increased diuresis, increased urinary output, which leads to weight loss. So the weight loss that we expect is around 15% in preterm babies, which natters at around 4 to 6th day. So birth weight is regained by 14 to 21 days. We can target it to happen by 7 to 14 days by ideal nutrient management. So what are the growth parameter for preterm baby? If the baby is more than 1500 grams, we target a weight of 10 to 20 grams per kg per day. And if the baby is less than 1500 grams, we target a weight of 15 to 20 gram per kg per day gain. The length should be gained by 1 centimeter per week, and the head circumference should be increased by 0.8 to 1 centimeter per week. What is the total energy requirement in preterm babies? So whatever is the resting energy, that is the baby, even if the baby is not doing anything, whatever the energy is required for the metabolic process to happen is the resting energy. If you add in the constant energy required for physical activity plus the catch up growth that is required for growth and adjusted calorie that is required for disease states, so that comes out to be the total energy requirement. Thank God we do not have to calculate all this for all our preterm babies. We have specific guidelines. We have people who have done the research in this field and have taken out some numbers that we just need to blindly follow. So the recommendation I was telling you is the ESPHGAN guidelines that we follow. ESPHGAN 2022 guidelines. These are the updated guidelines till now, and they have come up with the recommendation. We follow those recommendations. So what do they recommend for energy intake? They say that you should be giving 115 to 140 kilocal per kg per day of energy to a baby. Suppose you see that the energy intake is this much, 1 till 140 kilocal, but still the baby is not growing optimally, so you can increase up to 160 kilocal per kg per day. So protein to energy ratio of 2.8 to 3.6 gram per 100 kilocal is recommended. What is protein to energy ratio? It is the amount of protein divided by the total energy that you are giving, which should be between the range of 2.8 to 3.6 grams of protein per 100 kilocal. So this ratio we required it in this range. Why? Because we want the protein to be used for the baby to gain the lean. So what is the protein that is recommended? Human milk protein decreases rapidly over time. First 2 weeks around 1.5 to 2 gram per kg 1.5 to 2 gram per deciliter to around 1 to 1.5 gram per deciliter. Donor milk contains 0.9 to 1 gram per deciliter of protein. So what is the recommendation according to the ESPHGAN guideline? 3.5 to 4 gram per kg per day. No recommendation for adding supplements with glutamine, arginine or taurine. Plasma urea monitoring is conditionally recommended. So the recommendation for fats, a total fat intake of 4.8 to 8.1 gram per kg is recommended, although higher intake may be safe. Amount of medium chain triglyceride exceeding 40% of the total fat is not recommended. Linoleic acid intake of 385 to 1540 milligram per kg per day. Linolenic acid intake of 55 milligram per kg per day, and linoleic acid to linolenic acid ratio of 5 to 15 is to 1 weight by weight is considered acceptable. So DHA intake of 30 to 65 mg per kg per day, ARA intake of 15 to 100 mg per kg per day, ARA by DHA ratio 0.5 to 2. So this is all a theoretical thing that you need to mug up for the exam. So the carbs are given as fortified human milk at upper intake ranges is safe and improves in hospital weight, length and head circumference growth. Carbs recommendation is 100 to 15 gram per kg per day. Which charts are recommended for postnatal growth monitoring of preterm baby? Till what age these charts can be used, and what is the growth trajectories of concern? So the growth chart for monitoring of preterm baby, we have two types of growth chart. The Fenton chart above 2013 were not gender specific. The 2013 charts were upgraded and are gender specific. So they are formed by data from 4 million babies from 6 developed countries like Germany, Italy, US, Australia, Scotland and Canada. So data from population based surveys used, and the charts are plotted from 22 weeks to 50 weeks. 40 weeks onward data from WHO growth curve can be tracked. Alright, you can use WHO growth chart from 40 weeks onward. Now the next is into gain the lean muscle mass. Alright, so we want the protein to be utilized for muscle, and there should be adequate energy otherwise provided through other means. So this ratio is why important. It will grow chart. These charts is popular because it took into account countries like India, Oman, Brazil. Maternal nutrition and healthcare needs were also taken into consideration. So these are growth standards charts mainly. They tell us they tell us how the baby is growing, not how the baby should be growing. So they are growth standard charts. So this is the Fenton and this is the intergrowth postnatal growth chart. The intergrowth postnatal chart. What is with the Fenton chart? I'll tell you. See, this chart starts at 22 weeks, finishes at 50th week. Finishes at 50th week, divides. We have gender specific boys and girls. It is weight, head circumference, length. If the baby is falling between less than 10 centile is SGA, less than 3rd centile is severe SGA, more than 90th centile is LGA. Alright, so we follow this trajectory of the babies, like per week we can track, and we can see if the baby is growing appropriately or not. So this is what I have written here. After 50 weeks can be followed with WHO chart. Postnatal weight loss is not taken into consideration, hence high chances of SGA or UGR. Weight below 10 centile is termed SGA, and above 90th is LGA. Between less than 3rd centile is severe SGA. So integrated growth chart, it is plotted between 33 weeks to 44 weeks. Alright, postnatal weight loss is taken into consideration, so lesser chances of you diagnosing a baby with SGA or UGR. So it is also gender specific. It is also subdivided into head circumference, length and birth weight. Alright, and the centiles are similar: 3rd, 10th, 50th, 90th, 97 centile. Rest of it is similar here in intergrowth charts. So